The focus of this discussion will be on the cytotoxic effects of carboplatin, with particular emphasis on its effects on the ovaries following intravenous administration. Carboplatin is a synthesized platinum 2-based anti-cancer therapeutic. Carboplatin is second-generation cisplatin, an internationally used platinum 2-based anti-cancer drug whose toxic side effects and multiple resistance mechanisms have led to the development of a series of cisplatin-based derivatives. Currently, carboplatin is one of the only 2 platinum-based compounds approved for international marketing, in addition to cisplatin. Carboplatin is administered intravenously, typically through a cannula, central line, or peripherally inserted central catheters. This essentially permits carboplatin to bypass the absorption process. Carboplatin is also able to bypass any potential metabolism that it might otherwise undergo before being able to reach the bloodstream. Carboplatin directly enters the bloodstream and is able to be distributed systemically prior to uptake into its target tissue. It should be noted that binding to plasma proteins by carboplatin is minimal. Carboplatin is relatively nonspecific with respect to target cells and cellular uptake. This is evident based on the fact that carboplatin is used to treat multiple types of cancer. As such, carboplatin has many target tissues. For the purposes of this presentation, however, the focus will remain on the ovarian tissue and the effects of carboplatin on the ovaries. Carboplatin uses multiple mechanisms to gain entry into a target cell, which, in this case, is the ovarian cells. The compound's predicted low POW suggests that carboplatin is slightly hydrophobic and drug-like. The predicted pKa value, which refers to the amine groups, suggests that the amine groups will virtually always be deprotonated. These physiochemical properties provide justification for the occurrence of simple membrane diffusion, which has been observed to occur in the case of carboplatin. The cellular uptake of carboplatin is additionally facilitated by copper transport proteins, specifically CTR1. Human copper transporter 1 protein contains 190 amino acid residue and consists of 3 transmembrane domains, an extracellular N-terminus and an intracellular C-terminus. The loss of the copper transporter 1 protein has been shown to lead to a 2 to 3-fold increase in drug resistance. Following entry into target cell, carboplatin is susceptible to undergoing hydrolysis. As depicted, this metabolic mechanism is biphasic and leads to the detachment of the bidentate cyclobutane dicarboxylate ligand and its replacement with 2 monodentate water ligands. This process is non-enzyme mediated. As depicted, various equated carboplatin species are noted to exist in equilibrium within the cell. The 2+-diaquil complex is considered the ultimate toxicant. Carboplatin is also susceptible to interactions with thiol-containing species upon entry into the target cell. This can ultimately be causative of resistance to carboplatin. These species, such as the tripeptide glutathione, whose conjugation of carboplatin is catalyzed by glutathione S transferases, as well as metallothioneins, are rich in sulfur-containing amino acids and lead to detoxification because platinum binds avidly to sulfur. These interactions ultimately lead to export of platinum via multiple efflux proteins. Carboplatin primarily undergoes renal excretion. This occurs through glomerular filtration followed by excretion with urine. As such, carboplatin dosage depends on glomerular filtration rates. This method of excretion is plausible due to the fact that carboplatin rarely binds plasma proteins, as protein xenobiotic complexes are too large to pass through the pores of the glomeruli. Efflux proteins, such as multidrug resistance proteins and ATPases, which are efflux proteins involved in copper transport, are also present on ovarian cells and are able to modulate the export of carboplatin from the target cells and into the bloodstream, where it is susceptible to undergo the previously described excretion mechanism. Notably, MRPs are also known as glutathione S-conjugate export pumps and, as previously alluded to, facilitate the export of glutathione-bound carboplatin as part of a mechanism of resistance. As previously mentioned, the effector toxin is a metabolite that results from the hydrolysis of carboplatin upon cellular uptake. This non-enzyme-mediated hydrolysis leads to the formation of a diaquo complex, which directly interacts with the toxin's target. Carboplatin exerts its cytotoxicity through interactions with DNA. As such, the specific target of carboplatin is DNA. DNA plays an essential role in physiology, as it is described as being the repository of genetic information. As such, the integrity and stability of DNA is essential to life. Damaging DNA, provided DNA repair mechanisms are insufficient, leads to cellular apoptosis. It should be noted that carboplatin is susceptible to interactions with double-stranded DNA in a supercoiled or relaxed topology. Once carboplatin undergoes hydrolysis or equation, it is susceptible to exert its cytotoxicity by covalently binding with DNA. In particular, the most common form of binding occurs between the platinum atom and the nucleophilic nitrogen on position 7 of a guanine molecule, displacing a water molecule on the equated carboplatin. It should, however, be noted that binding to all bases is possible. This interaction between DNA and carboplatin typically occurs between two bases per platinum molecule, displacing both water molecules. This causes the formation of bridges between two bases. Such bridges are known as DNA adducts. The DNA adducts formed by the equated carboplatin molecule can vary in nature. Most common are the intrastrand crosslinks, which consist of the covalent binding of two platinum bases on the same DNA strand. Of these, binding between two typically adjacent guanine bases forms the most abundant species, although binding to an adenine base has also been observed. Note that, while rare, interstrand crosslinking between two guanine bases is also susceptible to occur. Interestingly, this type of crosslink is more frequently observed when DNA is supercoiled. The formation of DNA adducts results in the activation of several downstream signal transduction pathways. These pathways involve proteins such as ATR, P53, P73, and MAPK. As seen in the figure, said proteins activate multiple pathways that have various effects. Such effects include DNA repair via cell cycle arrest or the activation of apoptosis. In the case of the P53 protein, the activation of ATM and ATR, which are both kinases, leads to the phosphorylation and activation of P53. P53 can have multiple downstream effects, including, but not limited to, the activation of BAX, which leads to the activation of cytochrome C. Cytochrome C can activate the caspase 9, caspase 3 pathway, which ultimately results in the activation of apoptosis. As previously mentioned, carboplatin is a cancer therapeutic. As such, it remains beneficial to patients suffering from, among others, ovarian cancer, as its cytotoxic effects leads to the eradication of cancerous cells through induced apoptosis. Unfortunately, due to carboplatin's lack of specificity, the drug is often accompanied by many adverse side effects. These include, but are not limited to, neurotoxicity, as carboplatin is capable of crossing the blood-brain barrier, as well as nephrotoxicity, which makes sense due to the drug's previously mentioned proposed method of excretion. Because carboplatin is commonly targeted to the ovaries, a common concern is the possibility of infertility. The gonadal effects of carboplatin depend on many factors. Such factors include cumulative doses, combinations used, patient's age, and the pre-treated gonadal status of the patient. It should be noted that recovery from infertility is possible, although high doses have been shown to lead to permanent infertility. To summarize, carboplatin is an internationally approved drug that is used commonly as a therapeutic for, amongst others, ovarian cancer. Carboplatin undergoes hydrolysis upon cellular uptake, resulting in the formation of a positively charged diaqua complex, which acts as the ultimate toxicant. The ultimate toxicant exerts its cytotoxic mechanism through interaction with DNA, leading to the formation of DNA adducts. This leads to the activation of downstream signaling, which ultimately results in cellular apoptosis. This may have positive or negative effects at the organism level, depending on whether or not damaged cells are cancerous. It should, lastly, be noted that exposure of carboplatin to ovarian tissue has been proven to lead to permanent infertility.